because of the meniscus. This meniscus will act as a shock absorption. Like how you are wearing the shoes, how you can jump, and because this meniscus means half moon. You know moon, no?
Yes.
Half moon in English, the other term is called as meniscus. So it will be like that in the knee joint. Okay? If you see the biomechanics, I think some of the people who came to the biomechanics practical, I showed you in the knee joint.
Yes.
Some meniscus will be there inside the knee joint. So those are half moon shaped. Okay? So the test is called as Apley's compression test. Apley's. Don't confuse. Again, this one is Apley's crash test. So here Apley's compression test and distraction test. Here the patient will be in. Can you come to front line? Lie on our stomach. Patient will be in prone lying position. Okay? Therapist next to the patient. Bend the knee to the 90 degrees. Okay? Try to sit. Clasp both the hands. And apply a downward pressure. If the patient complains of pain during compression, problem in the meniscus. Just nothing you do, just you apply compression. Patient complains of pain during compression, it is meniscus. And keep the same position, apply one hand here, the lower aspect of the hamstrings, and try to distract. This is distraction, means upwards, pull upwards. Patient will tell no pain. So the problem in the meniscus. Compression pain, okay, and distraction no pain, the problem in the meniscus. Because when you are pressing, what will happen? The meniscus is pressing. When you are releasing, the meniscus pressure is decreasing. So if the pain is there during compression and the pain is decreased during distraction, problem in the meniscus. One more thing, if the pain will be there during compression and pain is also there during distraction, then the problem is there in the meniscus and your cruciate ligament. So you have to differentiate in that way. For example, some people will have injury of two ligaments, the anterior cruciate and the meniscus. So if only meniscus injuries means compression pain and distraction no pain. Clear?
Yes.
And if there is pain during compression and even during distraction, the problem is there in the meniscus and the cruciate. Clear? So this is the ligament testing of the knee joint. And the last test is, so what is the common problem again in the knee joint is osteoarthritis. You know arthritis means the bone space decreases and bone comes and rubs each other. That is one of the common problem in arthritis, like obese people, older people. What will happen as the age increases, the space between the bone decreases, and when the person is walking, he will feel some difficulty or pain. So for that we will do the test is called as tap test. What is meant by tapping? Tapping means like hitting with the finger. So patient will be in supine lying position, therapist in front of the patient. What the therapist has to do? Tap the knee joint slightly. Okay? If the patient complains pain, it means the patient is having osteoarthritis. See, why I am telling all these tests is, as a physiotherapist again I am telling you, without any x-ray or without anything, you should be in a position to tell the diagnosis. Not the correct diagnosis, at least okay, patient is having this problem. And then confirm your examination with the diagnosis, like your CT scan or MRI or x-ray or anything. Patient will tell, Doctor, I am having knee pain. But you don't know whether the problem is there in the anterior cruciate ligament or posterior cruciate or medial collateral or lateral collateral or the osteoarthritis. So perform the special test and see. For example, if you do tap test, patient will be in supine lying position and try to tap the knee joint. Apply mild pressure. Patient will tell pain. If you see old people and obese people, their leg, the knee joint will be very big size. When you are doing like this, they will tell pain. Because the space is very less, when you are tapping, the pressure will be more. So they will tell the pain. If there is any pain, the condition is osteoarthritis. Clear? Yes. So again, divide into two batches, practice the hip joint and the knee joint. Okay? Yes. I think hip joint, you are there now for the hip joint. You